everybody. My name is Beth Sanders, and I'm the founder and CEO of LifeBio. We capture life stories for better health, and LifeBio is addressing the healthy longevity and aging moonshot. We serve a large population that is needing help right now. The yellow chunk of this pie shows the 19% of the US population that will be over the age of 65 by 2030. And already we have a large aging population. So by 2030, we'll be at 57 million people. Agetech companies like us are addressing this population's needs and finding solutions. So now in the future, seniors suffer from loneliness and social isolation. Why is this a problem? Because seniors have chronic health conditions. They may be on oxygen. They may have other challenges with mobility that makes it hard for them to get out. Many are widows or widowers. Some have little or no social support. 4% are never married and have no children. So COVID has definitely shut down and limited outside opportunities for socialization too. And still other people face cognitive challenges or early stage dementia. This results in higher rates of depression, higher rates of Alzheimer's disease, poor heart health, poor diabetes management. And loneliness is costly too. Health plans find that they spend $1,600 to $3,000 extra on people that are lonely versus non-lonely. Medicare spends $214 billion a year addressing loneliness, depression, and Alzheimer's disease. And so these are the three areas where we concentrate our work at LifeBio. How do we solve these problems? LifeBio is doing what we can to address it with the research-based LifeStory App powered by AI. We're getting to know the whole person. It's a voice-powered way of gathering the story and then using the person's story for person-centered care management. So the process is important, and so is the finished product. We are seeing the whole person, seeing their resilience, their optimism, their purpose as they share it. Everyone is a story. And LifeBio Memory can work for just about anyone. But people with Alzheimer's or dementia or their family members can act quickly when they know they have this diagnosis to record their preferences, their past experiences, and other key information for family and care partners to truly know them. So LifeBio Memory uses voice tech, and then we use AI behind the scenes to process and then summarize the story. And another method that emerged from our work with United Healthcare was the need to provide solutions by phone. So on the right-hand part of the screen, you see My Hello. My Hello is good technology and it works. And people know how to use their phone. It's tech-powered and it's a live social engagement, social determinant of health, loneliness intervention. So during a pandemic or beyond, we can address social determinants of health. Let me give you an example of how this works. So meet Anna. She was engaged with LifeBio Memory, so the staff at her assisted living community could get to know her. You can see here on the bottom, on the left of the screen, the digital summary of who she is, what she likes to do, and her care info is here too. If she can't speak for herself, her family can help. Next, meet Lydia. She has participated in the My Hello program by phone because she had a high social need and was referred to us by a health plan. My Hello systems prompt us to ask the right questions to truly engage her. So in both cases, life story work, where we've come from and where we've been for a long time, is at the core. Data is king, and reporting from both LifeBio Memory and My Hello, it goes back to our B2B clients for business intelligence, care management, and tracking outcomes. We give our clients that personalized view and then this big picture view. Our results have been remarkable. We've reduced depression by 15%. We've reduced loneliness. We've truly found that we make lonely people less lonely. We've improved mood with our work with Mayo Clinic, with people with early stage dementia. And we've increased NPS score, which really, really matters to health plans, by 12 points in some recent health plan work. Who do we serve? The National Institute on Aging has awarded us $3 million in SBIR grants over the past 2 years to improve Alzheimer's care. This has helped us round out our development tech team. So it's a very strong team. And our latest grant with NIH is in conjunction with Brown University to actually build a diagnostic for tracking the progression of Alzheimer's. United Healthcare, Optum, Vitas, Ascension Living, and Mayo Clinic are our other clients. So our software and systems work across the health spectrum. Everything's tech-powered and app-based and phone-based and can scale. We're a woman-owned company based in Central Ohio. We're completely HIPAA compliant, and we have an incredible team, especially a really strong tech team, with our AI data scientists behind the scenes driving this work. So our revenue is 1.8 million in 2021, and we'll see 5 million, I think, in 2022. We have strong interest from health plans for SDOH loneliness support right now. And we're growing our home and community-based services with interest in person-centered care. And we're raising 2.7 million in our Series A round, closing March 2022. This is ideal for agetech investors or those interested in SDOH. Thank you. And we really need to build out sales and marketing and some more infrastructure and ops support. I'd love to connect with you, and I'd love to have you part of our round.
Thanks, Beth. Great job. You guys have built such an amazing platform, and I know you're just ready to scale it out. Question here in the Q&A: what will motivate the user to use this tool?
Yeah, well, in the case of LifeBio Memory, the app is usually it's a engagement thing. It's typically a care partner of some kind, whether it's family member, a staff member, someone is engaging with the person doing this if they're face to face. In the case of My Hello with a phone-based thing, in the case of health plans, they have us actually helping them recruit people into the program. So it's up to them. It's certainly, some people choose not to, but lots of people do choose to do it. So it's up to the senior if they want to be part of it, but they like it.
I'm sure they do. Tell us a bit about the AI component. How is AI helping your technology, and where do you see that heading?
Yeah, the AI right now is being used for natural language processing and then auto summarization. And that's really important because when you get people talking in LifeBio Memory, they can talk, but so the AI is really important because it summarizes it into one-page piece that they can see and know this person. And we know we have a caregiver shortage out there. And so as people come and go into these providers, they need a quick way to actually know these people. And we are helping with that.